Cold stagnation in liver channel. This is due to a cold pathogen invading and congealing in the liver channel and manifests as a cold pain along the liver channel. It is also called liver cold pattern. Key symptoms: cold pain in the lower abdomen and pudendum, vertex cold headache, a deep and tight pulse or a wiry and tight pulse. Clinical manifestations: cold pain in the lower abdomen, which refers to the scrotum and testes, alleviated by warmth, aggravated by cold, distension, and bearing down sensation in the pudendal area, or straining of the testes, or contraction of the external genitalia or scrotum, a vertex headache, cold body and limbs, a pale tongue with a wet and white coating, and a deep and tight pulse, or wiry and tight pulse. Analysis of cold stagnation in the liver channel. As cold congeals in the liver channel that leads to qi stagnation, qi and blood do not move smoothly, and contraction of the channels result. So there will be cold pain in the lower abdomen, straining of the testes, or contraction of the scrotum, and vertex cold headache. Cold pathogen damaging the yang qi will cause failure of the yang qi to spread, leading to cold body and limbs. This will also lead to coagulation of qi and blood, which is alleviated by warmth, aggravated by cold. And this will result in a pale tongue with wet and white coating, a deep and tight pulse, or wiry and tight pulse, which are signs of an excess cold pattern. To summarize, stagnation of cold in the liver channel, etiology is invasion of exterior cold. Underlying accompanying pathology, invasion of the liver channel by cold. Signs and symptoms: fullness and distension of the hypogastrium with pain, which refers downwards to the scrotum and testes, and upwards to the hypochondrium. Alleviation of pain by warmth, straining of the testes or contraction of the scrotum, bright white complexion, green, blue, or purple lips, vertex headache, a feeling of cold, cold hands and feet, vomiting of clear watery fluid, copious clear urine, loose stools. In women, there can be shrinking of the vagina. Pulse, deep, wiry flow. Tongue, pale and wet with a glossy white coating. Treatment principle: warm the liver and dissipate cold, rectify qi and stop pain. Acupuncture treatment. Ren 4, to scatter cold in the genitals. Ren 6, to warm the lower burner. Spleen 6, warms the liver, nourishes blood. Ren 3, scatters cold from the lower burner. Liver 5, scatters cold from the liver channel. And liver 1, clears the liver channel. Liver 3, courses the liver qi. We needle with drainage. Moxa can be used in large amounts if there are significant cold signs. Relevant advice: if the stagnation of cold in the liver channel is a chronic or recurring pattern, the person must make sure that they wear adequate and appropriate clothing and footwear. They should avoid exposure to the cold and damp. Thank you for your attention.